Did you know that every 40 seconds someone in the United States suffers a stroke? But here's something even more alarming. Thousands of people experience mini strokes every single day, and many don't even realize it's happening. These warning signs could save your life or that of a loved one. Today, I'll share 15 proven symptoms of mini strokes that you absolutely need to know. And trust me, number 10 might surprise you. Welcome back to Heart Alert Dr. Desa, where we break down complex health topics into truly useful information. I'm your host, and today we're diving into mini strokes, medically known as transient ischemic attacks, TIAs. These are temporary blockages of blood flow to the brain that can last from a few minutes up to 24 hours. Although they don't cause permanent damage, they're often warning signs of a major stroke. In fact, according to the American Stroke Association, about 1 in 3 people who suffer a mini stroke will have a major stroke within a year if they don't receive proper treatment. That's why recognizing these symptoms is absolutely crucial. Before we get into the 15 symptoms, make sure to subscribe and turn on the notification bell so you never miss our evidence-based health content. And if this video helps you or someone you know, share it. It could literally save a life. Please note, this video is for informational purposes only and does not replace professional medical advice. All research is verified and sources are linked in the description. Now, let's break down the key symptoms of a mild stroke. 1. Sudden numbness or weakness. One of the most common and recognizable symptoms. When blood flow to the brain is interrupted, even briefly, it can cause sudden numbness or weakness, especially on one side of the body. This often affects the face, arm, or leg, classic warning signs that emergency doctors look for using the NIH stroke scale. You might notice heaviness in your arm, trouble lifting a leg, or a strange, asleep feeling in a limb. But unlike normal tingling, this happens suddenly and without an obvious reason. Try the arm raise test. Stretch both arms forward for 10 seconds. If one arm drifts down, or you can't lift it as high, seek medical help immediately. 2. Trouble speaking or slurred speech. Have you ever noticed someone suddenly struggling to speak clearly? Difficulty speaking or slurred speech is another critical warning sign. This happens when areas of the brain that control language and speech are affected. You might find yourself unable to pronounce words correctly, talking as if you were drunk without drinking, or forming jumbled sentences. Friends or family are often the first to notice. Try saying a simple phrase like, "The early bird catches the worm." If you can't say it clearly, seek medical help right away. 3. Sudden confusion. A commonly overlooked symptom. According to research published in Stroke, 2018, sudden confusion is one of the least recognized signs of a mild stroke. It's not just feeling a little foggy, it's a sudden inability to understand simple things. You might feel like everyone around you is speaking another language, or you can't follow basic instructions. You could forget where you are, what day it is, or even who people are. This confusion can make it hard to realize something is wrong, which is why loved ones must stay alert. 4. Vision problems. A mini stroke can also affect your vision. According to the Mayo Clinic and the American Stroke Association, this can include blurred vision, double vision, or temporary blindness in one or both eyes. This may feel like a curtain coming down over your vision, a condition called amaurosis fugax. It happens when blood flow to the retina is briefly blocked. These changes happen suddenly, not gradually. Even if your vision returns to normal quickly, it's still an emergency. 5. Loss of balance or coordination. Research published in JAMA Neurology, 2019, found that loss of balance is common in many stroke patients, but often mistaken for clumsiness or ear problems. This isn't just feeling a little unsteady, it's a sudden inability to coordinate movement. You may feel like you're on a rocking boat, unable to walk straight, or veering to one side. Fine motor skills may also be affected. Buttoning your shirt, writing, or picking up small objects may suddenly become difficult. If this happens, sit down immediately and call for emergency help. 6. Facial drooping. One of the most visible signs. When one side of your face suddenly becomes weak or numb, it may droop. Try smiling in a mirror if one side doesn't move or your smile looks uneven. This is a classic stroke warning sign. You might also notice drooling or trouble keeping food in your mouth. Remember the FAST test. Face drooping, arms weakness, speech difficulty. Time to call emergency services. 7. Sudden severe headache. This headache feels different. According to the Cleveland Clinic, it often appears without a clear cause and is described as the worst headache of your life. It may feel like a thunderclap, hitting suddenly and intensely. This kind of headache, especially when paired with confusion or vision changes, is a medical emergency. 8. Difficulty swallowing, dysphagia. This one surprises many people. When blood flow to areas controlling swallowing is reduced, you might suddenly struggle to swallow food, water, or even saliva. You may choke, cough, or feel like something is stuck in your throat. This can lead to aspiration when food or liquid enters the lungs, a dangerous complication. Avoid eating or drinking until a doctor has examined you. 9. Tingling sensation. That pins and needles feeling can sometimes signal a mini stroke, but the key difference is that it appears suddenly and doesn't go away when you move. It usually affects one side of the body and may come with weakness or numbness. Even if it seems mild, it's still a warning sign. 10. Temporary memory loss. This one might surprise you. Brief episodes of confusion or memory loss, like forgetting where you are or who people are, can signal a mini stroke. According to Stroke Journal, 2017, this occurs when the temporal lobes, responsible for memory, are affected. It's temporary but alarming, and a clear red flag. 11. Partial or total loss of consciousness. While less common, this is serious. According to Johns Hopkins Medicine, partial or total loss of consciousness requires immediate medical attention. You might feel extremely drowsy, drift in and out, or faint completely. Never wait to see if it passes. Call emergency services immediately. 12. Vertigo. Feeling like the room is spinning? Vertigo can be caused by a mini stroke, especially when the back of the brain is affected. This is not ordinary dizziness. It can be so severe that you can't stand or walk. It often comes with nausea and involuntary eye movements, nystagmus. Sit or lie down safely and seek medical help. 13. Sudden mood or personality changes. This one can be shocking. Mini strokes can cause sudden emotional or personality changes, like anxiety, anger, sadness, or apathy. Loved ones might say, "You're not acting like yourself." These changes occur when the frontal lobes, which control behavior and emotions, are affected. They appear suddenly, not gradually. 13. Sudden mood or personality changes. This one can be shocking. Mini strokes can cause sudden emotional or personality changes, like anxiety, anger, sadness, or apathy. Loved ones might say, "You're not acting like yourself." These changes occur when the frontal lobes, which control behavior and emotions, are affected. They appear suddenly, not gradually. 14. Clumsiness or trouble grasping objects. If you suddenly start dropping things or can't perform simple tasks, it could be more than just clumsiness. You might have trouble buttoning clothes, typing, or holding utensils. This happens when brain areas that control coordination are disrupted. It's often one-sided, another key sign of a stroke. 15. Unexplained fatigue or weakness. Lastly, sudden, extreme fatigue that appears without exertion can signal a mini stroke. You may feel overwhelmingly tired or weak, as if all your energy has vanished. According to the Lancet Neurology, 2021, this type of fatigue comes from the brain not getting enough oxygen and energy. Don't ignore it. Get checked immediately. Today we covered 15 proven symptoms of mini strokes, from well-known signs like facial drooping and slurred speech to lesser-known ones like sudden fatigue or personality changes. The key takeaway: any of these symptoms, especially if they appear suddenly, require immediate medical attention. Mini strokes are your brain's warning alarm. Respond quickly, and you can prevent a major stroke or permanent damage. If this video helped you understand the warning signs, share it with your family and friends. You never know whose life you might save. Subscribe for more evidence-based health content, and turn on notifications so you never miss an update. Have you or someone you know experienced any of these symptoms? Share your story in the comments below. Your experience might help someone else recognize the signs early. Remember, this video does not replace professional medical advice. Always consult qualified healthcare providers for diagnosis and treatment. Until next time, stay healthy and informed.